watching the award-winning GHS-TV, a nationally recognized student television station.
Thanks for tuning in. This is Medical Talk, and I'm your host, Betty LaMarr. On today's show, we're talking about the wonderful advancements in diabetes research with Lesley Draffin, a registered nurse at AM Diabetes and Endocrinology Research Department. Hello, Lesley, and welcome to Medical Talk.
Hi, Betty. Thank you for having me.
Well, I am so excited to have you with me because, you know, diabetes is, we have such a prevalence of it, if you will, in the United States, in the world, and especially today we're centering on the Mid-South. Before we get started, Lesley, tell us who Lesley Draffin is and what you do at AM Diabetes Center.
I'm a registered nurse here at AM Diabetes. I have been here with Dr. Latif, who is the primary physician here. I've been with him for 10 years now. I've gone through a lot. I actually started off in the clinic as a front desk person and worked my way through nursing school, got my degree, and continued to stay here. Dr. Latif said, you know, let's do an insulin pump center. So I know that that's one of the biggest things that I'm known for. I helped create the insulin pump center that we have here at AM Diabetes. I did that for probably 3 or 4 years, I believe. And then Dr. Latif was like, you know what, I think you're really good at what you do, coordinating the pump center, getting everything in line. So he reached out to me, and here I am today doing clinical research. And I'm the research coordinator over a multitude of studies that we're doing. So.
Okay, before we jump into the studies, which I'm so excited about, tell us a little bit more about the Insulin Pump Center. There's so many people, as I said earlier, living with diabetes. Let them know a little bit about what the Insulin Pump Center is and what is an insulin pump.
Okay, so first of all, an insulin pump is primarily for someone who does multiple daily injections of insulin, the long-acting insulin, the fast-acting insulin. They just cannot get under control with these numerous injections a day. And an insulin pump is offered to say, hey, this is easier. You wear a pump, you change out tubing every 3 days, so you have a continuous flow of insulin instead of having to do injections. So it's also a comfort thing for a lot of people. And so we've created an insulin pump center that's specifically for these patients. So they come into the clinic and they are seen, you know, differently, not differently, but they're seen on a different side of the clinic. So they're more intense care, more personalized care. That's kind of our goal, is to have a more personalized experience for our pump users, because there's a lot of technology and things go wrong, and that's what we're here for, is to help guide them into this new era of devices in the diabetes world, because you probably know diabetes is just continuing to have more devices with management. So that's what the Insulin Pump Center is for.
Well, I know that AM Diabetes is on the leading edge of diabetes and endocrine caring technology. So I'm very excited about that. I mean, I cannot go on LinkedIn without seeing all the wonderful things that's going on at AM Diabetes Center. It's just a reminder that it doesn't have to always be about medicine, but also technology. So now, before we go into the research, because our last 2 segments will be all research, how did you transition from the Insulin Pump Center to the research department?
So I believe, I loved being the pump center coordinator. It really became a part of my heart, and it was my little baby. I helped create it and guide it to where it is today. And I feel all of the things that I learned with all of the patients that are on insulin pumps, all the new technologies that are available for insulin pumps, it kind of dived you into the research world of, okay, what's next? Like, you've got all these pumps, so what's the new upgrades for the pumps? What's after a pump? Like, what's the more things that we can do for our patients and provide more to them? So, Dr. Lateef has always had research at his heart. And, his son's been diagnosed with diabetes since he was a baby. So Dr. Lateef holds diabetes research very near and dear to his heart. So I believe with all of my advances in the pump center, research was just the next thing in line. Like, let's do this. Let's look out and see what more can we do to help with the management, treatment, possibly a cure. Like, let's do this. So, that's where we've gone, and, we're doing pretty good, I think. So yeah, that's pretty much what happened.
Well,
and I love it.
I know you do. I know you do. Because I tell people, when I think of AM Diabetes Center, first of all, I think about all the wonderful advancements, okay? Then I think about Lesley Draffin, because ever since since the first day I walked into AM Diabetes Center, I think in 2016, Lesley Draffin, RN, has always been there. And I'm so happy that you're still there, because I feel that you are very important to the advancement, not only of AM Diabetes Center, Lesley, but the advancement and research as it relates to diabetes. Now, we're going to go into, before we go to our break, tell us the study that's going on right now at AM Diabetes. And after we get this started here, we're going to come back after the break, and you're going to go take us well in depth to this study. What is the name of the study?
So the name of the study is called the INHALE study. So this is inhaled insulin, hence the word inhale. So this is for pediatric approval of Afrezza, which is already a commercially available inhaled insulin for adults, but we are really, really focusing on the pediatric portion, because that's an error that takes a lot more to get.
Okay, now I don't want you to take it any further, because I don't want to miss a thing. We're going to take a break, Lesley, and we'll be right back, okay?
We see the potential in every single student.
That sounds like a confession to me.
I love watching these kids as they start as freshmen in high school and watching them mature and grow.
At last, my right arm is complete again!
The theater program at GHS, it's something special.
Is very intensive, it's very interactive.
When a student starts here their freshman year, they start with Introduction to Theater. And after that year, they have a choice to either go into acting or technical theater. And then after that, they join our production workshop class. It's the class that is completely run by students.
The students do mostly everything. We build the sets, we do lighting, we make the costumes, we do the show.
We've got magic, we've got power.
It's very fun. I mean, everybody's very supportive of each other.
Now we're all in this together.
It's taught me so much about how to act and how to have a stage presence.
Not only are we teaching the students the skills that they need to be a great performer or a great stage manager or a wonderful lighting designer, we're teaching them skills that they're going to be able to apply to whatever they do in their life.
God bless us, everyone.
This department not only makes wonderful theater, but more importantly, this department makes wonderful people.
I won! I'm good! Get used to it!
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Medical Talk. I'm Betty LaMarr, and we're talking about diabetes research and technology with registered nurse and research coordinator Lesley Draffin. Thank you again, Lesley, for joining me on Medical Talk. Now,
You're welcome. Thank you for having me.
I mean, I couldn't have it any other way, right? So now we was just going into the research study that's currently being conducted, if you will, at AM Diabetes Center. Take us there. Take us to the name of the study and all that the study entailed during this segment.
Okay, so as I mentioned before, the name of the study is the INHALE study. So I do have a little brochure. It's nice and pretty and colorful. So this is for the pediatric approval of Afrezza, which is an inhaled insulin. So this Afrezza has actually been on the market for quite some time, but when it first came out, it didn't really get a good, marketing, I guess you could say. So it's been out for a while. It kind of had a lull moment. Now it's come back. So the adult population's on it. They love it. Well, we need our children focused, right? Because they're on insulin. This is a hard thing for parents to continue to have to do insulin injections. So Afrezza is here. So this is an inhaled insulin. It goes through the lungs. So it's an inhaler. So this is what it looks like. It's the device that it's used. So it's just almost like asthma. You know, if you have asthma, anybody that knows asthma, this is what it looks like. And you inhale it just like, just suck it in. And this is insulin goes through your lungs, and it's in your lungs within less than a minute. And it goes through the lungs into the bloodstream and is out of the body completely within 1 hour to 90 minutes, an hour and a half. So it's a real fast insulin. So this is used for meal times. So anybody who's on already, Novolog, Humalog, Fiasp, things of that nature, this would replace that. So they would continue to use their long-acting insulin, such as Lantus, Toujeo, Tresiba, all of that. So this is just a replacement for the bolus insulin. The ages that we're looking for are ages 4 to 17.
Okay.
The type 1 or type 2 diabetes, the older children can have type 2. Commonly it's type 1. Their A1C needs to be between 7 and 11. And as I just mentioned, they need to be on multiple daily injections. So that's mainly what we're looking for. We do have had some people who are on insulin pumps, but you have to be off of an insulin pump just because this replaces the bolus insulin. So that's why we have to do it like that. Some of the things that we don't want are anybody that has asthma, or smoking. Because as I mentioned, this goes in the lungs. So we want to be sure that there's nothing wrong with your lungs. No vaping, no smoking, and unfortunately, no one who has asthma or history of asthma. And there is a portion of the study that there is spirometry testing. This is FDA approved spirometry testing. It is a little difficult. It's forced vital capacity is what it's called, where you breathe in really, really hard and then you force it out as quick for 6 seconds. It doesn't sound like a lot at first, but it's pretty intense. I actually screened somebody for the study just the other day, and I was amazed at how well they did. I was like, oh my gosh. So that's the hardest part of the study. It is a year long, so I have to mention that is a year-long study. There's one caveat to it. So they are comparing multiple daily injections to Afrezza, meaning is Afrezza superior to Novolog and Humalog, or is it the same? So you've got one portion of people who are going to continue multiple daily injections, and then the last 6 months of the study, everyone is on Afrezza.
Okay.
So the first 6 months, we might have some people on Afrezza, and then people on injections. Last 6 months, everybody's on Afrezza.
Okay, Lesley, I'm listening to everything. This is really good, but I have a question. So if you still have to, I'm going to lay terms, if you still have to use all the other medicines or devices, how does this particular device make things better or easier for a person living with diabetes?
So, first of all, I think it comes down to, injections. Really, are you doing 4 or 5 injections a day? So if you go on Afrezza, you're doing 1 injection a day or 2 injections a day, depending on how many times you do your long-acting insulin. So this covers your meal times and your corrections. It's quick, it's easy. You can put it in your hand like this, and nobody can see it. So you can be out in public at a restaurant, and you just take this off, put your cartridge in there. It comes in cartridges, and there are different dosings that they have for it. So you just, pop it in there, pop it, and then just inhale, and it's 2 seconds. So as opposed to, I got to go to the restroom and prepare myself for an insulin injection, or, you're at the table, let me go do my insulin injection in 10 minutes before my dinner comes. You do this immediately before you eat because it acts that quick, and it's out of your body within an hour. So that's also another thing, is it reduces the chance of someone getting low blood sugars because it acts so quick and it's out of the body so quick.
Okay.
So.
Okay, now when we come back after this break, Lesley, I want to talk about the dinner part of it, okay? Because that's what I want to understand, why when you have to do it before your meals, okay? So we're going to jump into that when we come back.
Okay.
Stay tuned, don't go anywhere. We'll be right back with more Medical Talk.
Art is really an expression of the self. If you look at a piece of art, you can see the artist within it.
All just really depends on what I feel like doing at the time. I generally have different ideas every day.
I really get excited when my students come up to me with unique ideas that I've not heard of.
You can't let everybody tell you who you are or what your art is or how to be what you want to be.
I really let the students go according to how they're progressing, and I try to give them as much as they're able to handle.
Well, I like drawing a lot, and I like painting, and I like being able to improve my skill and show people my art.
I try to get them to think creatively. I think that's one of the few things that we as teachers really need to try to push with our students.
I can't sing. I can't act either, but I can do art, so that's why I chose art.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back. This is Medical Talk, and we're talking about the current diabetes studies being conducted at AM Diabetes and Endocrinology Center. Okay. Now, Lesley, we're back here. So we're talking about this device, this wonderful new device, and I noticed you mentioned eating and dinner. First of all, what is bolus, and how does bolus and that device come together as I guess you would say, a perfect marriage?
Yes. Okay, so like you said, layman terms. So bolus is your fast-acting insulin, your mealtime insulin. So most diabetics, if they're insulin requiring, they have two separate types of insulin. So you have your one insulin that you take in the morning or at night, and it covers you throughout the day. So it leaves you stable, right? So that's basal. So that's keeps you stable. So bolus is extra insulin. So you need an extra kick, and that's when you eat. So when you eat dinner or snacks, the way that food is introduced into your body starts creating glucose, right? So your blood sugar starts to go up. And you need insulin, so that would be your bolus insulin, to bring it down. The reason why you take it before you eat is because of the way that it acts. So if you take it, a regular bolus, so Novolog or Humalog, if you take that 15 minutes before you eat, by the time you eat, it takes about 15 minutes for your blood sugars to start going up from your food. It kind of does this. The insulin and the blood sugar meet each other. So the insulin brings your blood sugar down. So that's why you have to do it before you eat. So with Afrezza, you only have to do it like a minute before you eat, because that's how quick it acts. It acts in the body in 12 minutes. The other insulins act 30 minutes. And it takes about 3 hours for those to get out of the body. And this one, again, like I said, only takes an hour to an hour and a half. So you don't also, there's a term called stacking. That's stacking insulin. And that commonly happens with injections, because you take an injection with your meal, 2 hours later, your blood sugar's still high. So you take more insulin, and then you're sitting around waiting for it to come down. Well, with Afrezza, you just do a little cartridge unit, and it comes down within 30, 45 minutes. So it's a lot less waiting to get your blood sugar down. You can take it after you eat, but it's better for blood sugars and maintenance to take it prior to meals.
Okay, well, you know, Lesley, when I think about diabetes, it's a complicated disease, really, because 24 hours a day, 7 days a week, holidays, it don't matter. Diabetes is always there like a shadow. So, yes. I mean, I just feel like the community as a whole need to focus more on diabetes as just as serious as cancer or any other dreaded disease. But for some reason, people don't think that diabetes is really a big deal. And it is. It really is. So I want you to tell us, give me a little bit of the statistics, if you will, or of diabetes in our area, and how can people with diabetes get in touch with you all if they want to be a part of this study? Because a lot of people may not know about it.
Right. So, yeah, I mean, you know, that's why we're here with you, so that we can, you know, make knowledge of this study. It's very important. You know, anytime we have pediatrics involved, parents, you know, you have to deal with the patient and the parent with pediatrics. And I've done a few pediatric studies, and the kids that I get are just amazing. They're amazing individuals. The parents are amazing because they're all for it, whatever the kid wants to do. And I really feel like that drives me here. You know, like the fact that some people just, they're all for it. All or nothing, let's do this. So to get things approved on the pediatric side is very, very important, because that's what's going to make research and development even better. Because if we can get the kids on board, imagine what it can do for adults, because we already see it in kids, we see it in adults. So diabetes is so prevalent in Memphis alone. There's a lot of underdeserved communities just here in Memphis that they don't get the proper education. You know, they get so scared. I have diabetes, I can't eat a cookie. Yes, you can. You can eat a cookie, just not a whole bag of them. But and it comes with education. It's not a death sentence, and that's what we're here for. We're here to show you that this is something that you live with it. You don't let it make your life. It's just an extra piece of life, and there are people who just live on it day to day and bite it in little bitty pieces. But we want you to be able to be comfortable with your regimen, be comfortable to contact our office if you have any problems, or if you need to walk in because you can't get your blood sugars under control. That's what we're here for. So if make an appointment with our office, it's 901-384-0065. So that's any available appointment. Dr. Lateef is well accepting new patients. We, again, like I said, we have a very large impact on education. Education's a big deal. So we want people to be educated, because if you're not educated, then that's the scare factor, right? And we definitely don't want parents, children, adults. We don't want anybody to be scared. So that's where we're here.
Okay, Miss Lesley, we have 1 minute. I want you to run around really run around that wheel there with all the wonderful things that you all do at AM Diabetes Center.
Okay, so the top here is endocrinology. That's basically what we've just talked about, diabetes. We also do thyroid, hormones. The whole body is basically endocrinology, right?
I guess.
So we have AM.
Well, I would say this, because I'm getting a rap. When you said endocrinology, it covers everything. That answered the question for the full wheel. Ms. Draffin, I want to thank you so much for joining me today from AM Diabetes and Endocrinology Center.
Thank you. Thanks for having me.
You're welcome. I would like to thank my guest, Lesley Draffin, RN and Research Coordinator at AM Diabetes and Endocrinology Center, for joining me today on Medical Talk. Thanks for watching Medical Talk with Betty LaMarr on GHS-TV. Remember, you can also watch Medical Talk Fridays at 9:30 p.m. on Comcast Channel 17. For more information on our programming, please check us out on the web at ghstv.org, where we're streaming live 24 hours a day. You can also check us out on Facebook and Twitter. I'm Betty LaMarr. From all of us at GHS-TV, thank you for watching Medical Talk, and I hope to see you again.